Came from Hyderabad. I'm presenting a case of a 58-year-old gentleman by name Ramchandra Jadhav, resident of Maharashtra, is a driver by occupation. Came to hospital with chief complaints of pain in the right hip since 6 months and limb since 3 months. Coming to history of present illness, patient was apparently alright 6 months back when he developed pain in the right hip, which was insidious in onset, dull aching type, slowly progressive in nature. The pain is not non-radiating type, and pain is aggravated by walking, sitting cross-legged, squatting, climbing stairs, and he has partial relief with rest and pain medication. He had limp since 3 months, which was insidious in onset, slowly progressive in nature, and he is not using any assisted devices for walking. And his daily activities were restricted, such as squatting, walking, and climbing stairs. And he is not able to sit cross-legged. And he is not going to his work since 5 months.
Question? What is driver?
He is a driver by occupation. And there is no history of trauma, and there is no history of fever, loss of appetite, or loss of weight. There is no history of other joint involvement, and no history of small joint involvement. Pain was first. Pain since 6 months. 3 months.
I think just for the benefit of students, by the time the history presentation is complete in a long case, sometimes many of the examiners like to give you a historical diagnosis as to what you are thinking without touching the patient in which direction are you moving. So he has elaborated already, but I'll just like to highlight that, for example, pain. Now, if possible, you should try to put pain into one of the 3 common categories. He clearly mentioned that it is a mechanical pain, I agree, but just for the benefit of others, mechanical pain means that at rest he doesn't have any pain and any movement is causing pain. The second type of pain could be of an inflammatory joint disease because it is a hip case. So if the patient says, I get up in the morning and first 1 hour or so I'm very painful and stiff, you can ask him, what time do you get up in the morning? He says, for example, 6 o'clock. He says, by the time the sun starts rising, I start feeling better. So this is the second pain pattern which is usually seen in inflammatory conditions like rheumatoid arthritis or seronegative spondyloarthritis. A single hip involvement, we think of seronegative arthritis more than rheumatoid. The third type of pain pattern could be, he says, I have pain almost continuously, and particularly in the night I'm not able to sleep. And he has to get up in the night to move around to relieve the pain. So this type of pain is usually seen in infection and tumors. If it is possible, then you should try to put the pattern of pain into one of these 3, which will give you a definite clue into which direction we are moving. So from this history, it appears that it is like a degenerative disease. At rest, he has no pain, and activity is producing pain. The second important thing which I want to highlight is that suppose that these courses 2 years, 1 year or so. At the end of your history presentation, you should say whether a disease is progressively worsening with time. There can be one worsening with time. For example, if you don't treat tuberculosis, it will continue to worsen with time. But a degenerative disease may be static or maybe a plateau will come. And the second could be a waxing and waning pattern. That is again in favor of a disease like rheumatoid. The other is improving with time. Improving with time means we are not dealing with a very serious nature of the disease. But at the end of the history presentation, you should be able to say one of these 2 things: increasing, worsening, stationary, or waxing and waning, and of course 3 types of pain patterns. This will give you a good clue as to which direction are we moving. So this history looks like a degenerative disease, mechanical revision, and this no trauma, so obviously no fracture. Some other disease which is producing a degenerative disease of the joint. Thank you.
हो सकता है
Past history. Patient had no similar complaints in the past, and the patient had a skin disease since 15 years, for which he took medication on and off, one tablet per week, and he did not know what tablet to take. And there is no history of bronchial asthma, diabetes, or bleeding disorders.
Do you attach some significance to this skin disease which he is having? In relation to the hip disease, would there be any association of the skin disease with the hip disease?
Psoriasis.
So one could be a psoriatic arthropathy, single joint involvement, and second could be
steroid.
Prolonged drug intake.
so if there is an allergic skin condition, eczematous condition, we may have been taking steroids. So this can be further elucidated by direct questioning, even if the patient doesn't come forward spontaneously. If there is a generalized skin disorder, then you can ask some leading questions sometimes, because you know that it's possible. Proceed further.
He took medication for 15 years, sir, for that skin problem.
For skin condition, was it Ayurvedic medicine, was it a quack or what?
He told allopathic medicine.
Allopathy.
Doctor has given.
Doctor?
Just once in a week.
Yeah, once a week tablet.
Once a week tablet.
So this may be the one seronegative and all. Let's see. Okay. Once a week is methotrexate. Once a week for a disease or arthritis. You see, if the disease, the activity of the disease is under control now, he may not have any morning stiffness. See, morning stiffness will only be there in an inflammatory disease when the disease is active. If you have controlled it with DMARDs and other things, the morning stiffness rather may go, and only the degenerative elements may remain.
There is no history of tuberculosis. Family history, there are no similar complaints in the family, and there are no history of tuberculosis in the family. And coming to personal history, patient consumes mixed diet, appetite is normal, and bladder habits are normal, and the sleep is normal. And he is a chronic alcoholic since 30 years.
That's again significant.
He is non-smoker.
So have you elucidated the quantity of alcohol which he is consuming?
He consumes around 350 ml per day.
That is a significant amount. You know, have some idea about how much alcohol is related to
400 ml of
producing an
absolute alcohol per week.
osteoporosis of the hip?
400 ml per week. Absolute
I
alcohol.
forgot.
Forgot anybody?
400 ml of absolute alcohol per week.
200 ml. Absolute alcohol or what?
Absolute alcohol.
400 ml beer भी हो सकता है, whiskey भी हो सकता है, wine भी हो सकता है, but ठीक है, okay.
Whiskey में 42% है.
In the end, we'll see what it is.
All except beer. Beer
Under
is
physical examination.
5%.
Patient was moderately nourished, conscious, coherent, and there is no pallor, no icterus, no cyanosis, there is no generalized lymphadenopathy, there is no pedality.
General physical examination, what specifically have you looked for apart from the general examination which you have done? What is the role of lymphadenopathy? Huh?
In infective pathology, there may be enlarged.
Are we thinking of infective pathology? What do you think? Are we of course you must palpate the lymph nodes, but from the history, the type of history which you have described, do you think we are dealing with a case of infective pathology? A patient who has been taking alcohol for the last 30 years. In that case, what particular thing you should see, particularly look for in general physical examination? So if there is a hepatomegaly, fatty liver, palmar erythema, spider nevi, all those things, chronic alcoholism, what all it can produce? So in general physical examination, in such a case, when the history of taking alcohol is very significant, you should look for all these things in the physical. Even if they are negative, you should say that I have looked for and I didn't find it. But is spider nevi कैसा होता है देखा आपने?
It's a rash like
Dilatation is for this thing.
Spider. लेकिन
Arterial,
characteristic feature
arterial dilatation. Radiates outside from a central,
compared to the other varieties of
central
flesh on the body.
point.
Okay, चलो.
Because of